Hello, Tom LaVecchia here with the latest edition of the New Theory podcast. This is kind of a coming home to me because I worked in the aesthetic industry for a number of years, and we have arguably, I would say, the rising star and one of the most important people in the aesthetic industry, Dave Moatazedi, CEO of Evolus. Welcome to the New Theory podcast. How you doing today?
I'm doing well. How you doing, Tom?
Very well. And I'm really excited to speak to you because I feel your story is inspirational. So we'll jump right in. Tell us a little bit about your formative years and what kind of helped you shape your career and life.
Yeah, we're all shaped by sort of our upbringing, right? And my parents, they immigrated to the United States from Iran prior to the revolution. So in 77, and they came here to go to graduate school. And so they came here with the intent of going back to Iran after they completed graduate school. And shortly after they arrived here in the US, they were young. They had two kids and they were in their 20s. And the revolution occurred in Iran. And that's when there was a significant change in terms of the politics in the country. And they had no interest in going back, even though they were born and raised there and all their family and siblings were there. And so here they were in their 20s in the U.S. and decided to make this their home. And so that was it. I mean, that's what really shaped my upbringing was my father, who taught a bit at SMU for a few years and then decided academia was not for him. And he started to get into other businesses. And over the course of 20 years, he was in two different industries and built up a couple successful smaller kind of businesses. And that sort of crafty nature of being an entrepreneur and being in an environment where, you know, you decide what you want to do with your career. I mean, I think we take that for granted sometimes because I do have family in Iran and you don't have the ability to do that in most parts of the world. But the US affords you that luxury, and I'm certainly a product of that.
God bless. And that's what's crazy about this country is my family immigrated from Italy in 59. So you kind of had somebody in Italy at one point, you had somebody in Iran, and now you and I together sharing a screen, which is what's so great about this country. Early in your career, I understand you kind of had, and I was in a similar boat, but more importantly, it's about you today, where you were like with traditional pharma. I believe the med derm space, first kind of the traditional aesthetic space. I believe it was Novartis, first maybe Allergan, but you kind of veered off to aesthetic, which I respect because that was a big, bold move at the time. It wasn't the industry it was. Give us a little bit about the thought process of getting away from pharma per se and going deep into aesthetics.
Yeah. So right out of college, I had the opportunity to work for Novartis. I was in the medical dermatology space primarily and calling on dermatologists as a sales representative. And it was interesting because medical aesthetics was obviously very small back in 2000, but some of these clinics were starting to do medical aesthetic procedures. And so here I was with products for eczema and toenail fungus and so on, traditional medical conditions for the dermatology space. And I started to see this emergence of aesthetics. And it was intriguing to me. It was just how there was a separation within these practices of a traditional reimbursed business with a real small cash pay business. And it really wasn't beauty then. It was more of a functional benefit in terms of how these products were used. And in all fairness, I didn't even think about it in that lens either. I didn't have the context for beauty versus pharma, which is what it's really evolved to. But I had an opportunity a handful of years into Novartis where I'd done sales and sales management, all in Southern California. And I just finished business school. And I knew I wanted to do something else. I wanted to get more experience on the marketing side. And I had this opportunity with Allergan. And when I interviewed with them, that's when they said, well, we got this product in derm called Botox, and we need someone on the global product side to get involved. And, you know, the brand's doing pretty well, and we think it's got some potential. And I thought, you know what, I'll get my marketing experience and, you know, we'll see how good this brand really is and see where it goes. And then 15 years later, you know, after leaving Allergan. So, you know, in a lot of ways, I'd love to tell you, Tom, that I knew exactly what it was. And I went there and I picked that brand because I thought this category would be what it is. But that's not what happened. My derm experience enabled me to land an opportunity like that. And I've always gravitated towards opportunities to create versus established markets. That's always just been my interest, is to build things differently. And that's really what that was. So if that part of it is the reason why I landed on Botox, and I guess maybe, it was deliberate, but outside of that, the rest just sort of came along with the ride.
Now, you just jostled my thought. When you were calling on derms, I worked for the old Sharing Flower. Prior to that, we were big in the derm space. You had literally, you had a few different, Novartis was a living space as well. But I kind of knew that the traditional reimbursement, the traditional medical game was going to change. And I also that's why I went over eventually to kind of cash paying. Did you sniff that out a little bit? You're like, hey, wait a second, they're working harder, they're making less money. Some people are doing cash. Wow, there's a beauty product that's going to be cash. Did you have the foresight? What was it? Was luck, and what was foresight on? You saw the medical space changing, and that might have what's that word? Inspired you to go over to Allergan. Because I want to get your pivot point there.
Yeah, it's a good question. Actually, I hadn't thought through that in a while. So it's a really insightful question, because when I was at Novartis, this was at the peak of pharma, where what was happening was you couldn't hire enough sales reps and within the big pharma companies. And you'd hire all these reps, and then you'd sort of tell them, sell this product first, this product second, this one third, from a messaging standpoint. And then you'd put another rep right next to you in the same territory,
3, 2,
and they'd
1,
flip it and sell to the same customer in a different order. And it was all about just a human mouthpiece entering practice versus someone enabling that practice to be more successful. And your only currency was, one, your ability to spend, because pharma guidelines didn't exist. So if you could develop a relationship, then they're listening to you a little bit more, perhaps. All these products were pretty good too. Product mattered. But in the end, it was about your share of voice and how you can move the needle. What I did pick up on was it was just becoming saturated. Like, just because it works to add a second rep doesn't mean it works to add your 12th rep into the practice. And what was happening was, I was getting into some of the same offices because there was a relationship. But the next rep the doors were starting to be closed on them. And with consolidation in medicine, the chains were looking and going, this is counterproductive for my providers. And then reimbursement, especially in derm, which is now over 90% generic products and very few branded. Genericization was a real issue. So I saw a lot of friction in that world, and I knew that wasn't long-term going to be my interest in trying to decipher whether if you have a Pacific Care patient, this is the right product for them, and try to convince them, everyone else, don't worry about those other providers, just do it on this. It just became a game of nickels and dimes. And it wasn't really creating anything except for revenue for a big pharma company, but it wasn't creating a mutual relationship of value creation.
That's a brilliant assessment, because that's essentially how I felt, and I just felt it was going to go over to cash, and that's why I migrated over as well. We're going to talk about friction a little bit, because creating a frictionless experience is basically what put Uber on the map, right? And I kind of it's really interesting. I watched a show on Super Pumped or whatever it was. It was on Showtime, and it was about the initial launch of Uber. And when I follow you, David, as well, and I hear some of the things that you heard from Travis, and it was controversial at times, but as a leader and what he was trying to do, you're trying to kind of do a similar experience, a frictionless experience in the aesthetic industry. Just really quick, why get your MBA? I think you went to Pepperdine, I believe, and I have an MBA as well. I just went because they paid for it. Why'd you get your MBA?
Well, I was a chemistry undergrad. And so I was learning the discipline on the job, but I didn't have the textbook sort of experience about how do you think about brands, how do you study brands and consumer behavior and things like that. So I was just intrigued by that dimension of it. And that's really what drove me to go back and do my MBA. It also helped that Novartis was paying for the MBA at the time too. So that is probably the main reason why I did it sooner, rather than waiting further into my career to go back and do it. And I'm thrilled I did. Yeah.
Love it. Now, I used to call Allergan the evil empire, but I have what my biggest learning from Allergan: better and bigger marketing means better and bigger sales. And I want to hear your opinion on that. But when Allergan recruited you, it wasn't necessarily Allergan yet. Why take the leap to Allergan, and what was some of your learnings earlier on working for what I used to call the evil empire?
That's funny. So, what about our learnings early on? Allergan had an entrepreneurial spirit about it. I don't know if you know the history of Allergan, but it was founded in the 50s.
Yeah.
The original founder was a PharmD, and he was focused on ophthalmology. They were mixing things in a basement.
Yes, David ophthalmology.
And then they sort of became a market leader in eye care by being very customer centric, understanding what the customer wanted. Did that, and Allergan's largely credited in that specialty of eye care as one of the founding companies that helped build the eye care category.
Yes.
So that heritage of creation, in my opinion, is part of the reason why Allergan has been so successful in building an aesthetic business. They applied that sort of lens to this, and when it was first brought forward to Allergan management that, hey, there's this product that the ophthalmologists are using for strabismus, this blinking of the eye, and actually doing something for wrinkles, you had a company that was listening. Because if I juxtapose that to I don't want to knock Novartis because I think that's a great company in terms of innovation and pipeline and how they think, but commercial innovation, they're really listening for what the consumer wants. Allergan was very good at that. And when they saw that, they said, we've got to understand this better. And then they started to invest behind trying to understand the market, what the opportunity was, and then built it over time. And it wasn't easy going. People can say like a brand like Botox built itself. It didn't. It really didn't. I think Botox had many forks in the road where let's just say mainstream media would have loved to put a dagger in a brand like that. It was flashed back to 2004 and 5. You had celebrities coming out there saying this product morphs your face. You had scientific data coming out saying it affects your brain function. And we all know in aesthetics, the risk benefit profile is like zero. People want the look, but if there's any risk associated with it, not only is the FDA not going to approve it, but you're also going to get significant mainstream blowback. And when you're in a brand in a formative stage, you're very fragile. I mean, it's like brands are babies, right? And at that stage, that was a baby. And it was under a lot of scrutiny from the media standpoint, and it became a sort of this joke within the celebrity world, Saturday Night Live skits, things like that around this frozen look, this unnatural effect, this type of stuff that's the kiss of death. Many brands have never been able to come out of things like that. But to me, everything comes down to leadership. And I give a lot of credit to that team because they saw the bigger opportunity, but they also deployed the right resources to help educate, to overcome these issues. And then getting the medical community to stand behind something is so important. And you see it, the breast implant category is a good example. Plastic surgeons getting behind what's a political hot potato, FDA weighing in over many years. The reason why breast implants are available to consumers in the US is because of the medical societies and the doctors got behind them. You can make the argument that with balloons years ago, when balloons were having all their issues, the gastroenterology community said, this isn't safe, I'm not even going to be a part of it. Took 15 years later, now you've got an emergence of balloons again. They were safe. They just weren't being used appropriately. But without the right leadership at the table, involvement with societies, the whole ecosystem, certain categories don't survive. And I give Allergan a lot of credit. They were customer centric, meaning they're very closely involved with the derm societies, the plastic society. So as these issues came up, you not only have the credibility of the company, which only has so much value because you could argue there's financial interest, you have the medical societies standing up and saying these products we are certified dermatologists or plastic surgeons, and these products are safe, they're effective if they're used right. If they're used incorrectly, you may run into these issues. But they're standing up there doing that at a time when not all the science had been nailed down either, right? So, some of them are sticking their neck out a little bit, and that's what you need in early stages. You can apply that to Tesla, right? With their automated driving and people dying when something goes wrong. Should you kill it or should you keep it? They're formative stages, and without the right leadership, things like that would die. So I parallel that. So I went off on a track.
No, because you're going to see. We'll get to Evolus in a minute because I get your foundation of your training, if you will, right? So for Botox, you had market leadership, you had a monopoly essentially, right? But then Juvederm came along, and I was with the company Medicine Wrestling. And you guys did a really nice job executing for Juvederm and entering as a number 2. And there's a reason why I bring this up, but you're right. Great leadership. I don't know if you know Fred Hassan. He always says when the strategy is clear, execution becomes a strategy. So you guys had a clear strategy executed and did really well with Juvederm. So how did it feel, and how did your company deal at the time when you were there entering as a number two, but do a great job because you're used to monopoly, you built a market. Now you're into like a really formidable opponent in Metasys and Wrestling, but you guys penetrated the market successfully. Probably great leadership, probably execution. But I'd like you to give a little bit of the context to that.
Well, in 2006, when Allergan acquired a company named Inamed,
Inamed, yes.
rights
Breast
to,
implants, I think, and yeah.
that's right. The lap band came with that, and then the Juvederm product was right near FDA approval. Shortly thereafter, got the FDA approval. I remember this, number one, because I was the lead in the launch of Juvederm, but more importantly, I was the, I think, fourth or fifth choice to lead that launch.
Wow.
So I think a number of more experienced marketers were approached before me to do that,
Yeah.
rightfully so. But they turned the role down mainly because when you go out and you talk to doctors, they would say, Metasys is the derm company and they're the filler company. You're the toxin company. So there's no way you're going to be able to compete. Just Restylane is to fillers what Botox is to toxin. That was the view at the time. And so if you're on the receiving end of that, you're working on a brand like Botox, like, why am I going to go do this? It's like kiss of death on my career, which is probably true. Now, I was just crazy enough to say, yeah, well, I'll give it a try.
Why not?
So, you know, and what happened over time was, one, yeah, it's an excellent product. It always starts with having a really good product, but it was probably more similar than different than Restylane. In all fairness, both hyaluronic acids, both similar concentrations, and roughly the same longevity between the products.
Yeah.
So branding and positioning became the difference maker in that launch. And of course, Botox, having Botox as a starting point to build the next product off of is not a bad place to start. So you had the right infrastructure to launch a product like that. And then Juvederm became the market leader in its first, couple of years on the market. And the rest is history. It's the biggest filler product in the world today, by far.
Yep.
And then Restylane still right up there too. So both excellent products. You know, you asked me earlier, like, why did I join Allergan? Same reason I joined the Juvederm launch, and it's the same reason I came to Evolus. You see opportunities that you think you can create something that is different, and then you get rewarded for building that. And to me, that's the exciting part, is when you can take something that some look at as like, it's the same, or I don't know how you compete, and then you sort of look at it through a completely different lens, and then you get after it. And then all of a sudden you start bringing to life what you thought was possible when there was nothing there.
Yeah.
There's nothing like it. There's nothing like that feeling. And, you can get it in short stints. Like if you like working out, you may get it like your adrenaline rush, but we're talking about real sustainable, like a feeling of like, wow, I created something meaningful. And so we'll get into that in the world of Evolus. But for me in my career, Juvederm was the first example of being able to taste that and see it through.
And you're a natural born leader, so it made sense for you to go over and transition over to Evolus. So now that you're at Evolus now, right? And there were mistakes by other companies when launching Botox. I thought this Dysport, I don't know what it is now, but was disproportionately for like the benefits of the product versus its share. I always felt it was underrepresented, and there's a lot of mistakes when it was launched. When you launched Jeuveau, what were some of the mistakes you felt other companies make, and how did it help you? Because sometimes you win by not screwing up or by learning from other mistakes. What were some of the mistakes by other companies made when they entered the market against Botox? So when you launched Jeuveau, you kind of said, hey, you know what? Let's not do this, or smooth that out a little bit.
Yeah, it's a good question. So I'm also a student of markets, right? And being a student of market, you look at products that have entered and whether they're successful, and give them credit if they were, or all. On the flip side, every product can be scrutinized too. And so what are their weaknesses, and to be fair about it, right?
Yeah.
It's one thing to just criticize things just openly. Yeah, that's easy to do. Anyone can do that. But to really diagnose, like, what did they do really well, and where are the gaps that got created? A brand like Dysport. So for balance, I think Dysport was planning on launching in a very disruptive way. The brand was going to be called Relax, and
we didn't get the name. It was a lot. Yeah.
R&R with Restylane, and we all know all of that, the messaging and that look and feel would have looked incredibly different if it had been Relaxin than this generic name Dysport that most people couldn't pronounce when it first entered. So I think that launch got disrupted very early on as the FDA came in and said the name Relaxin can't go through. So that was number one. The second was how they reacted to that was to generically launch a toxin. And that against one of the most iconic brands in healthcare, it's just never going to work. So then what happened? It ended up being, I have Restylane, so use my toxin. And I've always struggled with that idea that I don't think, if I put a customer hat on, I don't want handcuffs. I don't want to put handcuffs on my customers to use my next product. I want them to love working with me as a company. I want them to really like my product because I put energy into them loving it. And then the fact that they can work with a company they love and now use more of my products because they love working with us and they're good products is great, because in the event that markets are similar, which in most cases they are, more similar than different, then I'm going to win on that strategy and everyone's happy in that approach. That's not a handcuff. That's a value creation play. And I think Dysport became a little bit of a leveraged Restylane to get Dysport versus if I juxtapose that to Juvederm. Juvederm was a fun brand. I mean, it just came in, people loved it. It was the launch that made it fun, a lot of consumer advertising. And we introduced this parentheses have a place, but not on your face. And so this mnemonic that was all of a sudden helping consumers understand what this did versus a toxin, because there was this sort of interchangeability in their mind, like everything's a toxin type of idea, or everything's a filler, but they didn't really understand the delineation of the two. I think some of those elements, they add energy to markets. I wouldn't underestimate. There's this sort of intangible. I talk to my team about this all the time. Like, you're giving me all the functional benefits. Give me the thing that gets me excited. How do you get a customer to look at a vial of Jeuveau and smile?
Yes.
How do they smile? Like, what does it take to do that? Like, what brands do you own? When you see them, you look at it and smile. Like, I love wine. If there's this bottle of wine that I love, if that thing's at the table, I'm smiling the whole dinner. And then, so how do you create that sort of where people have an emotional connection? I think Medicis did a great job as a company of making you want to smile. Restylane was that brand with the PR elements, first mover advantage that made consumers and their injectors really loyal to the brand. And it was a good product. I don't think Dysport ever created that emotional connection.
That I agree with that. So, which brings me to my next poignant question. So, fast forward, you launched Juvederm. Again, I'll be transparent. You could have been like, you know what? Let's just say it's closest to Botox as possible. It's as good, a lower price point. We're going to carve out 15%. We're going to get this to a $450 million product, and let's insert some other products, and stock market goes up and everything's great. But you didn't do that, which I like. So give me kind of your initial thought process when you were road mapping the Jeuveau launch, and then how did you feel the execution went versus that plan?
So the roadmap, and then the journey, and then the execution. Those are three separate conversations.
Said everybody has a plan to get punched in the face.
Yeah, to get punched in the face. That's exactly right. So the architecture of the company, can I start there? Because I think that if you ask me like 20 years from now, and let's just assume we are what I think we'll be, which is the next generation of an aesthetic company that's so appealing to this consumer demographic with products that make injectors smile and consumers gravitate to them. So when we get there, the question will be, how'd you get here? And I'd say the architecture we started with when we created the company. And there's a benefit to being in our category fourth entrant and 20 years late to the dance, in that technology really evolved. And when the other companies were formed, there was a lot of manual processes, a lot of backroom needs of people to do things manually. And when we formed, we said, let's journey map. What does an injector or practice have to do to get access to product, and how do they service their patient? And then what does the consumer have to do to actually enter this market and get a treatment? And what we uncovered was a whole bunch of friction points in terms of how they go through the process. And we said, okay, so if we really are going to do this differently, then we want to invest in digital, number one. Number two, in order to add value back to the accounts and not end up where the second and third player were like, hey, I'm a generic alternative or the same as them.
Yeah.
We have to have a position that we can own. Well, the challenge with owning a position when you have a similar label to your competitor is, what do you own? You can't claim anything. The FDA is even most restricting on toxins than any other category in aesthetics,
100%.
right? So what became clear was that this younger demographic looked at these other brands as pharmaceutical products, and they didn't really have, I don't, it wouldn't be fair to say, characterize it as a negative view of a brand like Botox, but they had very strong views.
Yeah.
Some were good, some were bad,
Yeah.
but strong views because it's such a significant brand in the consumer space.
Okay.
And when we did consumer research with Jeuveau, and we brought our design team in to really test a whole range of concepts, what became clear was our brand, when we put it in front of that younger demographic, she looked at it and said, this isn't your mother's Botox. This is a fresh product for my demographic.
Yeah.
That gave us the confidence between our investment in digital, which was designed to eliminate some of these friction points, and our provocative branding. It sort of had this license to be fearless, to be unapologetic as a brand. Yeah. And from that, it's easy to say that. So what does that really mean? Like, what did you really do?
Yeah.
Ideas like #NewTox.
Yes. Remember that?
Those ideas come out of the mindset.
Right.
The mindset isn't, I want to be like the other product. It's now, I want to be really different.
Yeah.
I want to live and breathe this younger generation, and I want to communicate in non-pharma speak. I want to communicate the way you'd communicate amongst friends and introduce these products in that way. And then we positioned the company early on as a beauty company. And that was going back to your questions about Novartis. I think what evolved in this category, when Allergan first started, this was a medical treatment.
Yes.
It was done by some dermatologists and some plastic surgeons. And if you're a consumer, you call, you book your appointment, and 30, 60 days from now, you would see your dermatologist. There'd be an hour block of time. Yep. And you'd show up, you'd sit in the waiting room, you'd be next to the patient with eczema, you'd be next to the patient with psoriasis, and you're the 1 out of 20 that come in that day for an aesthetic treatment.
Yes.
And you would go in and you get treated for your issues. Your issues where you had lines, you had fundamentally, I've got to treat these lines and wrinkles, and the dermatologist would go, okay, I'm going to numb you. We're going to leave you in there for 20 minutes.
Gotta mix.
I'm going to go treat my psoriasis and my eczema, and I'm going to pop back in here, and we're going to template out where we're going to inject. Yep. And so that's what it was. It wasn't an experience.
Correct.
It was a treatment. It was a medical treatment.
Yeah.
Fast forward to today.
Yeah.
Because you got to jump that far ahead to really
understand
how quickly this market leapfrogged. It's only 20 years.
Yep.
It's a beauty treatment.
Yes.
It's not a medical procedure.
Yep.
It's 15 minutes in and out of the office. It's a consumer that can book an appointment on demand that can get in the office by tomorrow morning, even same day in some areas.
Yep.
And it went from being maybe thousands of locations 15 years ago to over 30,000 locations, more than 2 times the number of Starbucks locations are in the country. Correct. This industry evolved, but it evolved around the consumer.
Yes.
And it evolved medically in terms of the ability to deliver consistent outcomes. Correct. But it's still in its early days. And that younger demographic, going back to the creative ad unit, when I'm sitting in the back of that room behind that glass, and I'm watching baby boomers react to Jeuveau, and they're like, how's it different from Botox? That's what they would say. Why would I use this? I've been using Botox for 20 years. So are you the same thing? Is that what you're telling me? Why would I do it? Then you put it in front of this younger demographic, and they're like, it's not your mother's Botox. It was very clear to us that we're digital, we're focused on the younger generation, and we're this fearless brand. And that's who we represent, and that's who we need to be.
So just to give people that are watching that don't, we're doing a lot of industry speak, but so Allergan had tons of budget, and when David was there, he was able to kind of get things done with great creativity, but great execution. Jeuveau, with their technology, they actually built out a tech team that was native to the team, West Coast developers, which were great. And they almost were like a tech company, right? And when we talk about making it frictionless, made it frictions for the office to order, get it, track their points, all that kind of stuff, and rewards, whatever associated, but also the consumer to share their experience as well. So that's one of the major points that I believe Javo, was going to set up Javo for success. I got a few more questions before we wrap up, but what, well, I want to do two parts. We're going to wrap up, but it's a few questions on each. The first is, what was your biggest challenge when Javo actually launched, right? You gave respectfully, a great thought process, right? But then you're Jane or Steve, you lace up, you go to Dr. Steinbrecht's office or, whoever, he waits an hour, then you get there, you're excited. And then he's like, all right, great, go talk to Joe. Like how did you create excitement for the brand? And how was your initial market entrance, and were you happy with it?
I'd say we created a lot of noise early
Yes.
on, and probably the goal was to have an outsized presence relative to the scale of the company. And I think if I put a checkbox next to it, I would have checked that box.
Correct.
What we didn't know with the product was, and this in retrospect, shame on me for not knowing, but every toxin that's entered the US has its own unique personality. Dysport does, Xeomin certainly does, and Botox was the original. So everyone assumed that is what everyone's personality
was. Correct.
That's the
Well, that was, and I like the chemist in you probably has a great appreciation for that. I didn't mean to cut you off there.
Right. Yeah, no, that's right. There's 1,200 steps in the manufacturing process. So even though we have the same molecule as a brand like Botox, when you put it through 1,200 steps, you get a different purified protein, right? And so the trials that you do with the FDA, they only look at this area and they look at it on a scale to tell you whether you eliminate the wrinkles. Well, every toxin eliminates the wrinkles, and they all go roughly whatever their duration is. What they don't tell you is what's the personality. The FDA studies are not designed to tell you that. And the investigators can't tease the personality, because you really don't know the personality of these drugs until you start using them throughout the face. You start using many patients, and the trials are not designed to do that. They're very focused on one area. So what we didn't expect from the studies, because we had done the largest head-to-head, we expected it to perform identical to Botox.
Oh, you would have danced a jig if it was 100% the same.
Right.
That actually would have been a win. Well, at least in my opinion, that would have been a win.
That's right. And the reality was it didn't. And the reason, and when it didn't, we left some customers feeling like this isn't the product you said it was. And it took us probably 18 months to understand that what we thought initially had been positioned as, oh, this isn't, see, we told you it's not the same product, it's not nearly as good, et cetera. That's what you heard from all the competitors, which is right. I would have done the same thing, by the way. So credit to all of them for doing.
But that's the thing, though, real quick, in the beauty space, it's so sensitive that counter messaging works better there than other markets, because a rep has 15 minutes and you're spending most of your time on the counter marketing. And you know this, if Allergan holds you off for 3 weeks, as nationally, makes another $100 million or whatever it is. So yeah,
it's significant. It's very significant, and notwithstanding the legal parts of it, we'll stay with that part of the legal. But what we learned, though, what we thought was initially going to be our big challenge is today our biggest opportunity, which is incredible, right? You hear that all the time in retrospect.
I know it's true.
This product has a precision profile to it that actually makes it very unique. We believe we may have the most precise toxin on the market, which arguably, right, for injectors that have mastered their craft, being able to push the limits requires you to have a product that's very precise. Think about, a fine point pen versus a blurry Sharpie, right? Yeah, a Sharpie is going to do the job if your goal is to smear things across. But if you really want to get precise, you want control. And we've learned now that the precision of Jeuveau gives these injectors the ability to do some things they weren't able to do before. We've leaned into that, not only with consensus papers, cadaver lab trainings. We create a whole medical affairs injection team that's in the field training injectors. So it changed the whole concept. We didn't have any of that when we launched. We handed them, we go, here's that data, you use it the same. And now today it's a completely different approach. And what you're seeing with the product performing is because it's real. It's not just marketing. It works, and it's proven scientifically, it's proven clinically, and now injector confidence is building. And what's funny is that, well, not funny, but what we're hearing now from doctors is that it's starting to become the preferred product.
Wow.
And consumers, the same thing. So, I envisioned, if you asked me when I first joined Evolus, I envisioned a fast ramp, and then the product sort of grows in line with the market. And it's actually been more
Yeah,
like,
the inverse, yeah, it's kind of a respectfully a slower
and
launch,
it's got a
and a
curve.
higher, yeah.
This thing has the same, in the net of it, the same peak potential in my mind that I always thought it would have, with a very different curve.
Wow. But at the end of the day, listen, you know what? You learn from, I don't say mistakes, but from getting punched in the face, if you will, from the market, learning from it, adapting of it. And that's what makes Evolus a special company. So final questions in terms of, for the interview, but in terms of, now let's get into the company. You know, you really seem to be focusing on building out, like, yeah, we could sat here and talk about more about Evolus and the product and the entrance and the market share, but that just seems to only be a part of your message. Now, really quick though, millennials, pinpoint, and that's loud and clear, right? But you're also focusing internally on building out a world-class organization. So give us a little bit about how you started doing that and how is that going for Evolus?
Yeah, it's that's everything, right? It's the talent you bring in, it's the way you structure and the way you get focused behind the opportunity. So the long-term opportunity is to remove friction points. So the digital team has done a brilliant job of building an application that doctors are using to order, that consumers, when they get their $40 off every treatment with our loyalty program, can do a text-based. But there's far more to be done on that front. We've just started the book now capability, which is when we advertise on social media or digitally, consumers with one EMR platform or expanding it to multiple can book their appointment directly in that doctor's practice.
That's
so
beautiful.
Don't pick up the phone and call, just click. That's what they're doing, right? They're doing it for their restaurant reservations, and the younger generation, that's what they expect.
Correct.
So it gives us the ability to track our investment directly to booking, but it also eliminates a friction point. And keep in mind, like, this is something that's lost on a lot of folks that are in our space, but it's not lost on people outside of it, because we talk about this being a consumer beauty space. If you run a TV ad for any of our aesthetic products and you run on a Friday night or a Saturday and a consumer sees it and goes, I want that product, I want that treatment, and they call an office, they're all closed. No one's answering the phone at that hour. So you don't really have access to these things. There's friction all along the way. And so things like Book Now means when we run an ad on a night or weekend, the moment you see it, you can book your appointment. Because you and I both know by the time Monday rolls around, what sounded good on a Saturday night doesn't sound so good now that I'm in the middle of my day job, right? So these are all friction points. They're little things, but collectively you start removing more and more of these. And what you end up with is a company that has a personality of being innovative, a personality of that the younger generation understands, and a brand that becomes appealing. So in the end, I think we are a brand builder with a digital capability that's looking to transition this category from pharma to what we call performance beauty. Performance being, that's what we categorize as sort of our vision, is be a performance beauty company. Performance being FDA proven drugs with a focus on the beauty side of this business to build them.
I got to do this. Doug Steinbreck is a friend. I know you know him. Has focused a lot on men in his practice, as three practices. What does the Evolus marketing team think about penetrating the male market?
I'll start with the male market. I think it's an incredible opportunity. There's no doubt. I mean, you go to retail stores and you would be in the skincare aisle. Men would be purchasing the same products as our spouses. And now you walk in and you've got dedicated sections to male skincare. So if that's not the tip of the spear, there's no doubt, it's coming even further and going to accelerate like a tidal wave. I consider millennials a tidal wave to aesthetics in this phase. The male market is that next tidal wave. It's in the formation stage, and tidal waves take time to form. Correct. And so male penetration has increased as a percentage relative to female, but it's on such a small base. And I do believe that over the next period of time will be a fast growing piece. Now, if you ask about Evolus, when you're a small company, you have to stay really focused. And by focus, it means we decided who we wanted to be in this initial stage. And what we wanted to be was a company that took the resources we have and we dedicate them to one segment. And it wasn't just women. It was a younger generation of women with a dedicated focus. And that meant we had to make trade-offs, and trade-offs against investing against advertising to men, advertising to baby boomers, which, by the way, are purchasing far more than millennials today. But millennials will be bigger in the next 3 years.
Well, it's going to age up, yeah.
it's unfortunately a call you make in order to get the focus you want. But that being said, I'm seeing the industry investing in bigger brands leading the way, which is the right answer in getting after that male audience, because that is going to continue to be a key growth driver for the market.
Got it. One last question before we wrap up. Teresa Pinson, Virtual Skin Spa, is a friend of mine as well. She's a large user of the product. She loves the product. I actually called her up and got the lowdown on her experience as a person who utilized it. I think it's her brand of choice. But you come from Allergan, where it was kind of the core, right? The four core. Versus now you have great injectors like Teresa and med spas, because there's a lower barrier to entry in terms of med spas getting into the space. Now she happens to be an MP and a little different. She's unique. I'm saying in general, there is a lower barrier to entry, and core is not as much as the market as it used to be. But kind of the old standby, oh man, you're gonna piss these people off. How do you balance hitting the core, plastic surgeons, derms, ocular, and facial? How do you satisfy core, but also going where your customer is, which is the med spas? I want to know your thought on that.
Yeah, I think fortunately the market as a whole has evolved from this separation of core versus non-core. I think the plastic surgeons and dermatologists that have embraced beautification and consumerism are adding more injectors into their practices. They're making it easier for consumers to come in and get treated with quick in-office visits of 15 minutes, et cetera. I think medical spa space, you got to credit them, because they came in and they were focused on creating an experience where doctors initially were focused on their white lab coat being the reason why. And I think they've since learned from the medical spa side. And by the way, medical spas have learned from the doctor side too, because during the last recession, medical spas were not focused on outcomes. They were just focused on experience and bring more people through, but they were losing so many patients. Correct. And so now they are hiring the right medical directors and ensuring their injectors are providing great outcomes. So I think what you're starting to get is a better rebalancing of the whole category, because in the end, the real growth driver is that consumer penetration going from high single digits into teens, 20 and 30%. The way you get there is by delivering consistently really good outcomes with great products and great operators, because the idea that you can just open up and with a single shingle and put on a white lab coat, you're going to be a big aesthetic account, that you think you might deserve it because you went to medical school, but that's not how this category works. And I think that's the evolution that we're going through, and I think that's what's brought down the walls between the two sides. And now you're seeing even the medical spas or the chains are employing the best injectors to train their providers, and they happen to be dermatologists and plastic surgeons as well. So there's no doubt that the skill set a dermatologist or plastic surgeon graduates with is going to be far greater than one from the non-core. But the plastic surgeons and derms are realizing that non-core is so hungry to be as good, if not better, that they will do everything they can to catch up. And that hunger has driven this side to understand that maybe there is an ecosystem that includes a broader group of customers. And it's been fascinating to watch, because there were barriers initially, and they exist to some degree now. But I would say the noise level is the lowest it's ever been on that.
That makes sense. Final question, David. You've been a gentleman. This is a random question I always ask my guests. You can have dinner with anybody dead or alive. Who would it be and why?
It'd be my grandfather, because I never met him on my father's side. My dad's always spoke so highly of him, and it's shaped, so how he thinks. And he was very influential in the area my father grew up in, and he gave back a lot. And I would want to understand his why and hear it through his lens.
I love it. I never met my grandfather as well, so it resonates with me. David Moatazedi, CEO of Evolus. I'll put a link to the website below, as well as the branded link. David, thank you so much for being on the New Theory podcast.
Thank you. Appreciate the time, Tom.